In HealthWorks this morning, this crazy weather can really irritate our skin. So what should we be doing to protect it? Well, joining us this morning is Dr. Sherry Ingraham with Advanced Dermatology. It's good to see you.
Good to see you too.
So we started off in the 30s this week. We're ending in the 70s. I mean, what can that roller coaster weather do to our skin? What kind of an effect does it have on it?
It can be very irritating to the skin, particularly because what we do to make it warmer. So when we put the heat on to offset that cold weather, it just leaches out all of that moisture in our skin, and so then we pile on moisturizers, and a few days later when things are warm again, you're on heavier products and you can start possibly breaking out your face with some acne. So you really just need to find a good emollient product that's not too heavy during this change in weather.
So you've brought a few things in to show us here. What kinds of things do you recommend? Do you say don't maybe use a lotion but more toward a cream?
Right now when temperatures are more on the cold side than they normally are in Houston, you want to use a slightly heavier product. So you want to use a cream. In the summertime, a lotion, and really when it's cold, when you're having a breakdown in your skin, particularly your hands, you want an ointment.
Okay, and what kind of regimen or routine should we be engaging in during these roller coaster temperatures?
Right now when we are putting the heater on, you need to think about protecting that skin barrier, particularly when we have these cold snaps up and down. So things you can do are use a soap-free cleanser all during the winter and really throughout the year when possible. A soap-free cleanser is excellent for protecting the skin barrier. You want to use a heavier cream, especially on the body, like we talked about. Face is different because you don't want to break out the skin, but for the body, Aveeno makes a great barrier cream, and I'm seeing this a lot in men in the wintertime. They don't moisturize as much as women do, and the lower legs get eczema and the hands get eczema. And so to prevent that, you really need to slather on a heavy cream at night.
Okay, and let's talk about lips for a second as well, because I know we cannot get enough chapstick right now, and I'm always running out of mine too. But is it important to just lather that on as much as possible?
Absolutely, but I try and tell my patients you want to get something very rich and petroleum based. So I say either get Aveeno makes a mixed petroleum product or just plain old Vaseline. Put it on throughout the day, and at bedtime try and stay away from other combination products. You want plain Vaseline. Put that humidifier on at night in your bedroom. That'll moisten the air. It won't leach it out of your hands, exposed skin, and especially your lips.
Okay, and then cracked hands as well. A lot of people have been complaining about that these last few weeks.
We've been seeing that all day long. So when you're in the bathroom, wash your hands with a soap-free cleanser so you're not taking that barrier off. Reapply moisturizer throughout the day. Use antibacterial hand gel when possible just on your palms to avoid washing the tops of the hands, which are what crack. At bedtime, get Vaseline, put it on your hands, some white cotton gloves that are $2 or $3 at Walmart. Go to bed, because you're basically re-implanting that God-given barrier we all have that we wash and wash and wash off during the day.
And if it's not improving, that may be time to see a doctor at that point, I would think, right?
If it's not improving after about 2 to 4 weeks of that, make an appointment with your dermatologist. There's some prescription products we can give you to help.
Okay, and save the hot showers for spring or summer, you say.
Cooler showers, shorter duration.
Okay.